Every employee returning to San Diego schools will be tested for the coronavirus. Good afternoon. Thank you for joining us. I'm Kimberly Hunt, and we're just days away from school being able to begin in-person learning. And as the countdown closes in on 14 days off of the state's watch list, schools reveal how they will monitor and control the spread of COVID-19. Meantime, we're learning exactly how big the digital divide is among students learning from home in San Diego County. Let's begin with ABC 10 News reporter Mimi Alcala with how they plan to execute the testing and what happens if someone tests positive.
There are more than 80,000 school employees across San Diego County.
This is everybody from bus drivers to food service workers to teachers to administrators.
While the majority of schools are sticking with distance learning for now, some are preparing to return for in-person learning. And the school employees that do come back will be getting tested for COVID-19 pretty often, a recommendation by the California Department of Public Health.
The recommendation is that in any given 2-month period, you've tested 100% of school employees, with about half being tested in any given month.
Music Watson is the chief of staff for the San Diego County Office of Education. The county is partnering with the Office of Education to develop extra testing sites specifically for school employees by late September. For now, testing will be available at the more than 20 county coordinated sites at no cost to school staff. So what if someone does test positive for COVID-19?
Is that if 5% of a classroom tests positive, that classroom would close and they would self-isolate for 14 days. If 5% of a school tests positive, the school would close for 2 weeks for self-isolation. And if 25% of a school district tests positive, then the entire district would close for that 2-week self-isolation period.
While the new efforts are being worked out, something is for certain. Even if a school shuts down for 14 days, students will continue to be educated.
That doesn't mean all of a sudden it's 14 days of no learning. It means transitioning to virtual, which might be online or might be packet work, depending on the particulars of that situation.
Mimi Alcala, ABC 10 News.
Testing for asymptomatic children is not currently recommended, but if a parent or a guardian feels the need to have their child tested, they can talk to their pediatrician or contact Rady Children's Hospital.